Hi, I'm Ruth Hansden, and I would like to record a little bit of information about assigning during a pandemic based on questions that I have received after a charge nurse webinar and also some other questions after the LinkedIn article that I've recently published. So this is how we get started. We're looking at the 5 rights of delegation and supervision, remembering that no matter what, if you're in a charge role and you're making assignments, that you're going to make sure that under these circumstances, the right competent person is able to perform that task that also has received the right direction, communication, and the right supervision and ongoing feedback. So that's how we make teamwork work no matter what the issue. Remember, number one is that their routine care delivery model is not going to work because you don't have equally substitutable staff. You are dealing with inexperienced floats from other areas of the hospital, maybe ambulatory care, and then also professionals that have been rushed through that last quarter of school, volunteers, retirees. You may be working with teams that you're not used to working with, like proning teams that are helping people in respiratory distress with COVID. Intubation teams, and obviously more severe people and material shortage. I don't have to tell you that. But think about then what tasks and functions are absolutely essential to be done. And if you look at the tasks, some of these can be delegated or assigned to other people that might be coming as part of your team. Vital signs, hygiene, hydration, movement, turning, toileting, meds and IVs, respiratory treatments, and point of care testing like chem strips, that type of thing. So those are things that can be perhaps assigned or delegated to folks and in a functional way. And then you have to think about who can be safely accountable for that total patient, for assessing, for managing care, for making sure the work is getting done appropriately. That has to be a registered nurse that is experienced enough to be able to do that. So think about functional teams that can do specific functions or groups that work together that support each other given the competencies that they have and the strengths and weaknesses that they have. You might want to look at hybrid teams. So you have maybe teams of 2 or 3, or perhaps as a charge nurse, you also have a functional person that works with you that you can deploy to various rooms and areas or groups of patients to do specific things, like would you please help that RN who's working alone with the hygienic care, or help them with donning and doffing the PPE. So these are some of the ways that you can actually look at how you might work with the group that you are given on a given day. So each shift could change the variation. So you might find that you have 3 people teams, and a patient care tech is what I'm saying by that PCT there. You might have an LPN, or maybe you don't have any LPNs, but you might use an RN who's from another area in a role of a patient care tech, but doing some other functions as well. You could have RNs working alone, total patient care, if that were possible, given the assignments that you have and the people that you have available on your unit. Particularly if there are people that you think might be pretty unstable and you need a lot of RN supervision with that patient's condition. You can ask people to do functions. Once again, grouping things as much as possible because of the PPE shortages. So there are various different ways that you can experiment with given who you've got available on each day. Remembering always the 5 rights, that's your basic concept that you're remembering. And here are some excellent resources for you. I wanted you to know about the Academy of Med-Surg Nurses that just sent out a toolkit to help people do self-assessment for what their competencies are so that they might be able to work on a med-surg unit, and they would give you that list of competencies from taking that online self-assessment. And also we have some recommendations to the critical staffing shortages. Also, there's a couple of webinars that I've done in the past, and also that LinkedIn article that I referred to earlier. And if you have any questions, please contact me. And I hope that you will stay safe, stay healthy, and good luck.